So, what does it mean in healthcare if something is low risk? So, like a low risk test or procedure, medication, or even, holistic treatment, supplements. What does it mean if it's low risk? Basically, if it's low risk, that means the risk of side effects, complications, that includes death, is less than 1%. So, less than 1 in 100 people. But it's not 0%. Anything you do to your body, any procedure, medication, supplements, even natural treatments, everything has a risk. Anything you put in your body has a risk to it. Even if we think of super healthy things like exercise, which helps prevent your risk of heart attack and stroke and cancer and other, disease processes, it also, when you exercise, there is a risk that you could injure yourself or get a muscle sprain or muscle injury, fall down while you're exercising. And so, really, nothing you can do to your body, unfortunately, is completely risk free. But in healthcare, what we're trying to get to is a less than 1% risk. It's considered low risk, but that's still not zero risk. And so there's always some people who are going to get side effects, complications that includes death, unfortunately, because there's really nothing you can do to your body that's zero risk. Now, something is considered moderate risk in healthcare if the risk of complications, side effects, including death, are 1 to 5%. And something is considered high risk if the risk is more than 5%. So 5 out of 100 people will have a complication that could be serious, including death. And that's not usually recommended for people unless you come in having some sort of life threatening condition and this is your only option. But usually in medicine, we're going for less than 1% risk. But again, nothing is going to be zero risk. Even if you drink too much water, that has side effects. And so, there's always a risk of anything you put in your body or anything you do to your body. And so, what you have to do when you're, trying to decide if you want to take a medication or do a test or a procedure is weigh the risks and benefits. So, generally, even though there's risks of exercise, the benefits outweigh the risk because it can help, prevent heart disease and stroke and serious things like that. And so, most people, it would make sense for them to do exercise for the prevention of other disease processes, even though there's a risk that they could get injured while exercising. And so that's what you have to weigh is the risk versus the benefits of anything you're going to do. And that's why it's important. It can be hard to figure that out. And especially with so much information and misinformation on online and on social media. So it's important to have a trusted healthcare provider, doctor that you can discuss this with to decide what's best for you in your specific situation.